The next methods for treating premature ejaculation are intervention-based treatments, meaning certain surgical procedures performed by a doctor. And now I will tell you about them. First, let me start with those interventions that are not widely used today because they are not very well studied, but they still have a right to exist and are worth mentioning. The first is the injection of Botox into the muscles located near the male genital organs, specifically the bulbospongiosus muscles. And this Botox, it relaxes these muscles and prolongs sexual intercourse. But again, as of today, it is not well studied and is not widely used. The second method, which also has a right to exist, but again is not very well studied, is RF radiofrequency treatment. That is with special equipment, a needle, they affect the nerves by delivering a very strong ultrasonic electrical impulse, and this impacts those nerves. This can be compared to what oncologists use RF therapy, radiofrequency therapy. They puncture the tumor, yes, with a needle, and through that needle they deliver very strong ultrasonic impulses. And it simply cooks the tumor, turning it into a sort of charcoal, which is then naturally eliminated from the body. The same principle applies to premature ejaculation. RF therapy works, but again, as of today, it is not sufficiently studied and not all doctors are able to perform it. That's what I'll say about that. Now, let's return to the more commonly used methods, which are currently employed by both myself and my colleagues. Again, we will proceed from the least to the most intensive methods because premature ejaculation should be treated starting from the simplest approaches and moving to more complex ones, from sexual act prolongators to major surgery. If we consider interventions, then among the interventions one can use the injection of higher density hyaluronic acid fillers, yes, that is intimate fillers. Hyaluronic acid fillers injected into the frenulum or the glands of the penis. Because if you didn't know, I'll tell you now, the frenulum is actually the most sensitive spot on the glands of the penis. We inject intimate fillers into this area along with medications that capture serotonin, and it starts to work. For example, I recently had a patient to whom we prescribed Zoloft and performed a filler injection. And a month later, he calls and says, no, it's not really working, you know. Maybe we need to add more filler. I said, yeah, okay, come in and we'll take a look. And then 2 weeks later, he comes in and says, you know, everything has fallen into place. My sexual intercourse has lasted longer because the filler started working. He started working, he disconnected, he made a cushion between the larvae and the skin. And there was no such irritation during sexual intercourse. So you can use special intimate hyaluronic acid fillers, but you should be prepared that these fillers last for 10 to 12 months, depending on your metabolism. These are the same fillers used for lips, like women inject into their lips, but the density is different. They are denser because intimate areas are more prone to a higher metabolism. If you get sick, they might only last, say, 8 months. But you have to be prepared for the fact that fillers in the frenulum and the glands of the penis may need to be injected, and you'll need to get them injected every year because they dissolve. Simply put, this is done under local anesthesia. The procedure takes 30 to 40 minutes. As of today, if you're just getting the frenulum injected, the cost is around $300 to $320. If you're getting the glands done, it's a bit more expensive. Now, here's some very important information for you regarding fillers. If the lidocaine test works for you, then most likely fillers will help as well, because they have the same prolonging effect in cases of premature ejaculation. The second surgical intervention method is frenulotomy. Frenulotomy, simply put, is a frenulumplasty. That is, if the frenulum was especially tight, it gets more irritated during sexual intercourse. And with frenulotomy, we make an incision in the frenulum and perform a plasty, placing 1 or 2 stitches, and that's it. After that, the duration of sexual intercourse improves. It is not as quick because there is no irritation of the frenulum itself. The third intervention can be circumcision of the foreskin of the penis. How does this happen? Again, this is done under local anesthesia. It is very important to note that, look, in the postoperative period, this can actually worsen premature ejaculation. You might ejaculate even faster at first, but then the glands will rub against your underwear and the callus will form on the glands. In other words, the skin on the glands of the penis will become rougher, and as a result, sexual intercourse will last longer. The final intervention, if all the previous measures have not helped you, can be penile denervation. Penile denervation is a major surgery. It requires hospitalization in a department. Before that, you undergo a range of tests that are necessary both for me as a doctor and for the anesthesiologist. How is this procedure performed? We completely expose the shaft of the penis and locate the nerve endings there. How do I perform this procedure? We cut the nerve endings that are less than 1 millimeter and more than 3 millimeters. That is, I leave the nerve endings that are 1 to 2 millimeters in size, but I don't cut them in just one place. You have to look for them all over the shaft of the penis, going around like the hands of a clock. And you more or less cut both the small ones and the large ones. After this, you have to be prepared that for 2 to 3 months, there will be no sensation at all. There will be an erection, but there will be no sensation because the nerve endings that have been cut are searching for some kind of impulses, more or less, where stimulation occurs. And the nerve endings that remain are not as easily stimulated, which leads to a longer sexual act. This can result in the duration increasing from 2 minutes to 6, 8, or even 10 minutes. In this case, denervation is individual for each patient. That is, for some people it may increase by 2 minutes, for others it may increase by 5 minutes. And this is a very serious operation. There are certain advantages to this operation, but there are also disadvantages. I already mentioned one of the disadvantages. For 2 or 3 months, there may be no sensation in the glans penis, but over time it returns because, you know, it's like when electricians test electrical cables, they send a signal here and over there they figure out which cable it is. It's the same with these nerves. If those nerve endings that were cut, they will figure it out. Our body isn't stupid, and the nerve endings understand that there's stimulation over there. So it sends more sensitivity to that area. And because of this, in the area where the nerves were cut, they don't function, but over there they start to function better. And over time, sexual intercourse improves and lasts longer. Now, I've told you about the main techniques, the causes, and the treatment methods. Whether you need to undergo treatment at all is something you have to decide for yourself. I'll leave links here to my social media where you can contact me about this issue if you need to. And in the next video, I will answer the most interesting questions I've collected about premature ejaculation and what to do in such cases, as well as respond to your questions. So even if you have questions, you can ask them in the comments and I will definitely answer them. And if you know of any other methods that have helped you personally, you can also write about them in the comments. I'd be interested to read them, because there might be some new methods out there that I haven't heard of yet. So enjoy this video. Thank you all. Give it a thumbs up. I look forward to your comments.